Good morning, and thank you for joining us. Well, Nebraska Medicine needs extraordinary people, and that includes nurses and patient care techs who will work with our neurological team. So who are we looking for? Who would be a good fit for this position? Joining me today with more information are nurse manager Eric Borgmeyer and nursing professional development specialist Brooke Brown, here to give us details on what it's like to work in this unit. So thank you both for joining me today.
Thank you for having us.
Thanks for having us.
You're welcome. So we have so many different opportunities here at Nebraska Medicine to work with different patient populations. So explain to me, because neurological, some people might think of stroke, but maybe don't have any idea what we're talking about beyond that. So what kind of patients do you work with?
Yeah, so I can take that one. So we are a 48-bed inpatient unit. We take up the entire 6th floor of the Clarkson Tower. Our primary patient population is going to be strokes, all the different types of strokes. And then we do see quite a bit of epilepsy, Parkinson's disease, multiple sclerosis, traumatic brain injuries, brain and spinal cord tumors, and surgicals. And then we also, since we are one of the largest units in the hospital, we do get some general med surg overflow. So we'll still see cardiac patients, we'll still see an occasional liver patient. So yeah, we have a really great mix of patient population.
What makes your unit unique, Brooke?
Yeah, so as Eric mentioned, we do take epilepsy patients, and what's unique about those patients that we take is we actually have a dedicated area on the unit called the EMU. It's the Epilepsy Monitoring Unit. And so what we do is we admit those patients on a Monday, they're a planned admission. We take them off their seizure medication. So we actually stop those medications, and we want them to have seizures here in the hospital in the safe environment. So what we're kind of looking for there, they're hooked up to the EEG monitoring. So we're looking for, where are their seizures happening? What medications are they on? Maybe they need a medication adjustment. So it's a really cool experience for our nurses and our care techs to see this all play out. And those patients usually get some answers while they're here in the hospital. And so that's a really cool thing too, that our nurses really get to, feel good being a part of. And yeah, so we are actually a level 4 epilepsy center too here at Nebraska Medicine. And then another great piece that we offer or have our nurses complete is the NIH stroke scale certification. So every nurse that starts on our unit will become NIH stroke certified. And what that means is that they're able to complete that NIH assessment on our stroke patients.
So what about challenges? Because that sounds like a really rewarding opportunity, but every unit kind of comes with its own challenges as well.
Yeah, I would say on our unit specifically, it is going to be, the patient population is challenging. Neuro patients are challenging. They do have a lot of comorbidities. And with the neuro patients, it's not something that we can generally just change your medication and all of a sudden your stroke goes away. There's a lot of emotions. It's a process or a journey for these patients, and that's something that our staff have to learn and grow with. On this unit, you definitely will learn that patience, and then that's where our teamwork really comes into shine. Our nurses and care techs really partner together to give these patients the best outcomes. And then we have an amazing relationship with our physician team, which is something that is pretty unique for the neuro patients.
Obviously, all of our jobs and our lives have changed over the last year. How has COVID affected your unit?
Yeah, so we saw some changes on our unit, going back to last year when everything started. So we actually relocated our entire unit to another area of the hospital last spring. And then, since then we had moved back, and then we had shared our unit with another cardiac unit as well, kind of split it half and half, all to accommodate our COVID population. So it was tough, but at the same time, we knew bigger picture. We needed to, keep patients and our staff safe. And we rallied together and we did what we needed to do.
I think it's neat that a lot of our nurses have had the opportunity to work in different units and basically work with different patient populations. For nurses who might be within the organization, who might be with another organization, who are kind of intrigued by that idea, they're often curious about patient ratios. So what are they in your unit?
Yeah, so our standard patient ratios would be 4 patients to 1 nurse on day shift and 5 patients to 1 nurse on night shift. We do adjust that depending on the patient's acuity, just because on this unit we do see anything from an observation status all the way up to a progressive level of care. With the way that we do our assignments, though, we make assignments in pods, which is typically 2 nurse assignments and 1 patient care tech, and they will kind of work in a group together. So we really take that team approach, and I mean, nursing is a team sport, and on the neuro unit, it's there's no exceptions with that.
Patient care techs are a position that we're always looking for, and the responsibilities are different unit to unit as well. So for care techs, what types of things do they do?
Yeah, so our care techs do a lot of things. They play a very vital role in our team on the neuro floor. They kind of own that ADL piece. So ADL's activities of daily living, that's the bathing, the walking, getting their vital signs, helping them with eating, that sort of thing. So mobility in our neuro population is huge as well. And so our care techs really take that on themselves and really play such a key part in that mobilization of our patients. And it's important with our population, the stroke population, rehab is such a key component.
I would imagine you guys see some pretty amazing breakthroughs. What's the most rewarding part of working with this patient population?
So I think the most rewarding part about working with this patient population is we do get to see some of those breakthroughs. When we are able to definitively decide, okay, based on the location that you had this seizure, we are going to, you're eligible for a surgical intervention, which is going to completely change somebody's life. They aren't going to need to take all those seizure medications. They're going to be able to return to more of a normal lifestyle. Also, we do get quite a few patients that will come back up and see us after they've completed their stint at rehab, which is so rewarding, being able to see all the hard work that you did to get that person to go to rehab, and then have them come up and visit when they're here for a follow-up doctor's appointment, just to see the staff and see that person walking around without any extra help is definitely the most rewarding thing that we see.
Who are you looking for to work on your unit? Because obviously your team is very tight knit. What kind of person would be successful both as a nurse and a patient care tech?
Yeah, I think somebody that really enjoys and thrives in a fast-paced environment. Like I said, we are a 48-bed unit, and there's days where we can have 15 to 20 discharges, and there will be patients in the line to come and fill those empty beds. So somebody that really enjoys that fast-paced work. Somebody who's patient and understanding of neuro conditions and how life-altering that process is. Having something happen to your brain it changes absolutely every aspect of your life, and those patients can be frustrated. So somebody that really understands and cares deeply about that. I think an eagerness to deliver extraordinary patient care is top of mind. Desire to learn, develop, and grow themselves. Somebody that is team oriented and accountable, and really has that drive to be challenged on a daily basis.
I've had the opportunity to do some of these interviews and explore the different units, and they always talk about the sense of team. So Brooke, what is your team like? How do y'all support each other?
Yeah, gosh, we have such a good team on the neuro unit. Like Eric has mentioned, our patient population can be challenging at times, but we really pull together and just work well together to get the job done and keep the patients safe. Our night shift, especially, that's the first thing that's coming to mind right now, is they coordinate so well on night shift to go into the rooms together and get everything that, assessment and the turns and all the cares they need to do in that room together. It's amazing to see, really.
Well, thank you both for your time today. Anything to add about for people who are prospective employees and are interested in these positions? I'm putting Eric on the spot here.
Yep, sorry, I was coming off mute. So yeah, anybody that has any interest at all in a position, either in the neurosciences unit or at Nebraska Medicine, by and large, definitely should reach out to our HR department. with any questions or concerns about that. I'd be happy to sit down and speak with anybody that has interest in joining my team in the neuro unit or at Nebraska Medicine as a whole. I've worked here since 2009, and I could not see myself working anyplace else. The opportunities to grow and develop yourself are huge. I came in as a patient care tech and worked my way up all the way to nurse manager. And like I said, I really would not work anyplace else.
Well, perfect opportunity for people to explore careers within the neuro unit and throughout the hospital as well. Brooke and Eric, thank you so much for your time. Again, our website is nebraskamed.com/careers. You can come work with these two. So thank you all for your time today, and thanks for watching.